Nikolas London. I'm with Retina Consultants San Diego in Southern California. So I'm at ARVO presenting a cross-trial comparison of multiple studies looking at using anti-VEGF agents for retinal vein occlusion, both central retinal vein occlusion and branch retinal vein occlusion associated with macular edema. We've had about 10 years of experience now after the first FDA-approved drug, Lucentis, back in about 2010. So we've got a number of clinical trials, and essentially what I'm doing here is comparing the outcomes, the basic outcomes in those clinical trials, both visual acuity and reductions in OCT, central retinal thickness, across the studies. So we divided the two groups up. So we looked at separately branch retinal vein occlusion and central retinal vein occlusion and looked at them separately. So we picked the biggest studies that we could, the phase 3 and phase 4 clinical trials. For branch retinal vein occlusion, we're looking at BRAVO, we're looking at SHORE, we're looking at BRILLIANT, and we're looking at VIBRANT. For the central retinal vein occlusion studies, we're looking at CRUISE, Copernicus, Galileo, CRYSTAL, and SHORE study as well. So they were all at least 12-month studies. In each of these studies, patients received monthly injections of the anti-VEGF agent if they were in the anti-VEGF arm, and that was at least 3, and some of them it was up to 6, up to the duration of what we looked at. And then the majority were then treated on an as-needed basis after that. And we looked at visual acuity gain, letter gain, at 6 months, as well as the reduction both quantitatively, the OCT, central retinal thickness reduction in microns, as well as the percentage reduction in those patients. At baseline, we looked at characteristics as best we could. We looked at evidence of macular or retinal non-perfusion. We looked at afferent pupillary defects. We looked at their baseline letter scores and OCT thickness, so we could compare them. It's a little bit difficult to do these studies because you're comparing large clinical trials with very different methodology, different baseline characteristics. And so that's part why we tried to keep it simple and look at just a few metrics in order to compare, and I think they're valid comparisons the way we did that. So for the branch retinal vein occlusion across the studies, the letter gain was about 17 to 19 letters for the ranibizumab treated patients, and I think about 18 letters for the aflibercept treated patients. Slightly lower in the central retinal vein occlusion studies. Patients gained on average in the ranibizumab treated group about 12 to 15 letters, and I'd have to look, but I think it was similar, 15 or 16 letters in the aflibercept group. In regards to central retinal thickness reductions, again, patients all did quite well. In the branch retinal vein occlusion studies, the average reduction was about 250 microns, and it was similar across drugs, and slightly more reduction in the central retinal vein occlusion studies, about 300 to 400 microns in reduction. For both of them, the takeaways are quite similar. The bottom line is that all patients seem to do quite well treated with anti-VEGF therapy regardless of the agent used. And so these studies looked at patients or trials that included ranibizumab, trials that included aflibercept, and across studies, across drugs, pretty much everybody did quite well.